In my research, I am interested in the role that our schools and education systems play in promoting the positive mental health of students and supporting students who experience mental health problems and mental illness. So why incorporate mental health education and support into schools? For one, mental health problems are common. As many as 1 in 3 Canadians will experience a significant mental health problem in their lifetime, and the majority of those mental health problems will develop during school age. In fact, 1 in 5 students in BC classrooms are currently experiencing significant mental health problems. And unfortunately, of those students who are in need of services, as little as 30% get the supports that they need. Additionally, incorporating mental health supports into schools allows for us to meet students where they are at, because most are already spending a significant amount of time in school, up to 30 hours per week. Beyond providing additional formal mental health services in schools, we are able to reach the most students when we take a whole school, collaborative approach to supporting mental health needs of students. When this happens, we start to break down the silos, and mental health is not just the responsibility of the school counselor or community mental health provider, but teachers, special education assistants, administrators, and students begin to take on a role. In whole school approaches to supporting student mental health needs, the concept of mental health literacy becomes foundational. This is the idea that there are certain competencies and knowledge that we all should have surrounding mental health and mental illness. Specifically, mental health literacy includes the knowledge, skills, and attitudes that allow us to recognize, manage, and prevent mental health problems. When mental health literacy is developed in school settings, educators are able to understand and implement student mental health promotion strategies. There's also enhanced capacity to identify students in need of mental health services and help them access appropriate community supports. Additionally, mental health literacy promotes positive attitudes towards mental health and reduces stigma to create a more inclusive and supportive environment at school. I initially became interested in educator mental health literacy during my master's research, where I interviewed youth with anxiety and depression about their experience of school-based supports. Out of all the services and supports the youth discussed, they spoke in the most depth about the significant impact that teachers have on their experience. The youth reported that when educators are knowledgeable about mental health, willing to accommodate a student's individual needs, and show that they care, this goes a long way in supporting students who are dealing with a mental illness. Educators are increasingly being recognized as frontline responders in supporting student mental health. Educators themselves acknowledge that they are required to respond to student mental health needs in their daily practice, but they often feel ill-equipped to do so due to lack of relevant training or uncertainty about their role. In my research, I seek to address this gap. I engage with high school educators in skill-building mental health literacy workshops with the goal of increasing their knowledge and competence in supporting student mental health needs. Following the workshop, we collaborate in a school-based action research team where we plan, implement, and evaluate mental health literacy practices. This includes programs and policies that impact the broader school community. Through student engagement and the lived experience of the educators, we are able to tailor our plans to the specific needs of the school community. This research will not only have a direct impact on the high school communities I collaborate with, but will contribute to the public good more broadly by helping to identify the actions required for educators to feel knowledgeable, supported, and confident when incorporating mental health literacy into their practice. By increasing educator mental health literacy, we increase our capacity for whole school, collaborative approaches to supporting the mental health needs of students. Thank you.